Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Dollenboat, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on the YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled Turkey Carving Injuries, a hand surgeon's guide to not ruining Thanksgiving. Today's article covers one of those predictable injuries that happens with depressing regularity every November. Picture this: the turkey's done, family's gathered, and somebody ends up in the ER with a nasty hand injury. Not exactly the holiday memory you were hoping to create. Each year, nearly 90% of Americans eat turkey on Thanksgiving. That's a lot of carving. And unfortunately, that means a high potential for injury. And they're almost always preventable. A quick story. Just like the 4th of July, Thanksgiving is a holiday that most hand surgeons would prefer not to be on call for. In fact, I'll never forget my first Thanksgiving on call. I was a fellow, which was my final year of surgical training, in Boston. 2 weeks before, I had finally secured my attending privileges. Basically, this was the first time that I was licensed to operate fully independent with no other surgeons needed. So you can imagine, I was nervous. To pass the time in the hospital, anxiously waiting for my pager to go off. Yes, I said pager. I wandered down to the staff lounge where they were throwing the on-call staff a Thanksgiving meal. The mood was merry and the spread was impressive. At the end of the long line of buffet-style food, there was a turkey carving station. And there Bonnie was, the most cheerful and chatty staff member, absolutely slicing and dicing her way through the giant turkey. The problem was, she also felt it was her job to entertain the entire room with her stories, routinely waving her knife wildly through the air as she gesticulated with a perfect emphasis on her tail. Needless to say, she was paying zero attention to how close her fingertips were to that fast-moving blade. But I sure noticed. In fact, I couldn't look away. I was glued to the action, my heartbeat racing with every downstroke of the steel. At least it was just a short walk to the operating room. Fortunately, she somehow avoided disaster, as did I, though it was no comfort to think of the entire city of Boston out behind the hospital walls, perhaps handling their knives with equal abandon. So let's go through a few tips to keep in mind this year. Unfortunately, these are lessons that my patients have taught me over the years, ones that they had to learn the hard way. A perfect storm. So here's what typically happens. The designated turkey carving expert had a few drinks while watching the football game. Later in the afternoon, the turkey finally comes out. Everyone's hungry and a bit impatient. Maybe they're using a dull knife because nobody thought to sharpen it before. Add in some slippery turkey juice, and poor lighting, we've got a recipe for disaster. The other bummer is that these injuries can be surprisingly serious. What looks like a simple cut will often sever the tendons or nerves that sit just beneath the skin of your fingers and hands. And while nobody wants to spend Thanksgiving in the ER, just waiting to see if it'll get better can make things much worse. If you need surgery, getting it done within the first week gives you the best chance at a good outcome. So the first point, sharp knives are safer knives. Just like we discussed in my How to Cut Avocados article, as counterintuitive as it sounds, a sharp knife is far safer than a dull one. Why? Because you won't need to apply excess pressure to force it through the meat, which is usually when things go wrong. If you're having to push really hard to get through the turkey, your knife isn't sharpened. Also, serration is your friend. Use a back and forth sawing motion with a serrated knife rather than the forceful push to keep yourself safe this November. The next is to keep everything dry. Your knife handle, your cutting board, your hands. Everything needs to stay as dry as possible. And this is no small task while carving a turkey. Turkey juices are slippery and greasy. Unfortunately, that's when accidents happen. Keep a towel on your hip or a roll of paper towels handy to wipe things down frequently as you work. Yes, even the wiping can be a hazard. I've seen a few fast swipes of a blade with a towel turn into deep cuts that run all the way down the finger. The next tip is to light it up. Make sure you can actually see what you're doing. Good ambient party lighting is not good turkey carving lighting. Save the ambiance for the eating and the conversing. When it's turkey carving time, blast the bright ones. In case it wasn't obvious, a well-lit cutting area helps you see exactly where your knife is going. Let's prevent those accidents before they happen. The next point, skip the pre-dinner cabernet. It wouldn't be an American holiday if there weren't a component of alcohol wrapped up in the tradition. Just like the 4th of July, these staples of Thanksgiving, meaning the turkey and the booze, are perilous when mixed. I wish I didn't have to say this, but maybe don't let Uncle Jerry carve the turkey after he's on his 3rd beer. One tradition you don't want to add to your family lore is a visit to my operating room in November. The next point is all about when you need help. If you do cut yourself, here's what you need to know. Apply direct pressure with a clean cloth. If it's still bleeding after 15 minutes of continuous pressure, that's your cue to head to the ER. Same goes if you can't clean it properly, aren't sure about your last tetanus shot, or if you see a gaping wound with edges that won't come together. And please come see a hand surgeon right away if you notice any ongoing numbness, tingling, or difficulty moving your fingers. These are signs that you might have injured more than just the skin, and the sooner we address it, the better your outcome will be. So some takeaways from today. Sharp knives, dry surfaces, and good lighting are your best defenses against turkey carving injuries. Don't delay seeking treatment if you get cut. What looks minor on the surface can be serious underneath. And if you notice any numbness, tingling, difficulty moving your fingers after a cut, please see a hand surgeon immediately. These injuries don't have to ruin your holiday. With a little preparation and common sense, you can keep the drama confined to your traditional family bickering rather than in the ER. And hey, if you found this helpful, share it with whoever's been nominated to be this year's turkey carver. They'll thank you later, and so will I. Thanks for being here today. See you next time.